Coronavirus cases in the United States are crossing yet another devastating threshold, 10 million documented cases, and the 5 highest days of new cases since the pandemic began in March have all happened here in the past 5 days.
Tonight, coronavirus exploding coast to coast. The U.S. adding 1 million new infections in the last week alone, pushing total cases to 11 million and forcing more states to crack down.
That's right. Corona is blowing up in Europe and America again.
President-elect Joe Biden making it clear the work begins today with the pandemic his first order of business. Biden briefed by his new coronavirus task force, led by former Obama Surgeon General Vivek Murthy, David Kessler, who ran the FDA under George H.W. Bush and Bill Clinton, and Dr. Marcella Nunez-Smith, a professor of public health at Yale. He also implored every American to do their part.
We could save tens of thousands of lives if everyone would just wear a mask for the next few months. Not Democrat or Republican lives, American lives.
This morning, as more Americans lose their lives, there is growing hope a vaccine will soon save so many more.
The drug giant Pfizer said yesterday that its vaccine candidate was more than 90% effective in early testing. Dr. Anthony Fauci, the government's top infectious disease expert, called the news extraordinary. He also says there are likely to be other effective vaccines coming soon.
It's extraordinary, Wolf. It is really a big deal.
With Pfizer now on track to seek emergency FDA approval as early as this month, the 2-dose vaccine, given 3 weeks apart, is being called one of the biggest medical breakthroughs in a century.
Earlier this year, Dr. Fauci said that he'd be happy if a COVID vaccine was 60% effective.
90% is a game changer. 90%, now you're hoping to have a tool in your war against this pandemic that could be significantly effective.
So let's break all of this down. There were 43,000 study participants. Half received the vaccine, half received a placebo. And then of those 43,000, only 94 people became ill with COVID-19, and only 10% of those who were sickened were people who had actually received the vaccine.
Pfizer's vaccine could be rolled out to frontline healthcare workers as early as December. And overnight, more promising news for patients with mild to moderate forms of COVID. The FDA giving emergency authorization to Eli Lilly's experimental antibody treatment, similar to the one President Trump received.
Would you take it?
Well, I'm going to look at the data, but I trust Pfizer. I trust the FDA. If they look at this data and they say this data is solid, let's go ahead and approve it. I promise you, Andrea, I will take the vaccine, and I will recommend that my family take the vaccine.
It's a massive logistical challenge. How to move hundreds of millions of doses of a COVID vaccine to Americans across the country. Pfizer's vaccine must be kept at 70 degrees below 0 Celsius. While it waits to submit the vaccine for emergency FDA approval next week, the company is already setting up a deep cold storage supply chain using suitcase-sized cooling boxes to ship critical supplies to doctors and hospitals nationwide, possibly by later this month.
Then there's, of course, who would get it first, right? So as you're a doctor, how do you go about prioritizing the list? Obviously, it's expected that first responders and frontline workers are probably going to be getting it first. But when you start rolling it out to the general public, do children become vaccinated because they're spreaders? Does it go to the elderly first? How do you go about making that list?
U.S. Advisory Panel has already laid out who could get priority in receiving a vaccine, starting with frontline doctors, nurses, first responders, and nursing home workers. Then people of all ages with 2 or more risk factors. The next phase would include teachers, school staff, child care workers, and people working in the food supply chain. Phase 3 would include children and young adults 30 and younger. Phase 4 would include everyone else living in the U.S.
Folks out there are not willing to take this vaccine, at least from the latest polls that we have, one from Gallup back in September saying only half of Americans would be interested in taking the vaccine. And then, of course, we have an anti-vaxxer movement in the United States that is gaining in steam and in power. How difficult do you think it'll be for yourself and other public health officials and other doctors to push this vaccine out on adults, on children, and encourage folks to take this vaccine?
It's going to be a huge problem, I think. There is no science behind the anti-vax movement. The science that was there, that was put out, has all been debunked. It just doesn't exist. Now, this particular vaccine is new, and we need to see that safety data. And I think once we have that safety data and it's rolled out, we're going to have to set an example. As those first-line providers, we're going to have to set the example and say, we took this, we believe the data that it's safe. If that data is there and it is safe, we need to take it and show people that this is the best way for us to reach a place where we can actually go back to how things used to be. So a little of this is going to be us setting an example, and the group that gets it first, setting an example and saying, we're not having the side effects, we believe the science, and we need to do this to help each other out.
All right, Dr. Anand Swaminathan, emergency medicine physician in New Jersey, thank you so much for joining us.
Thank you.